There is concern tonight about a potentially deadly virus here in Boston. The health department is trying to contact hundreds of air travelers who may have come in contact with a MERS patient at Logan Airport. Lauren Leamanczyk is live in our satellite center. And Lauren, we now know that the patient is in Florida.
Well, that's right, Lisa. He passed through Boston on his way from Saudi Arabia to Orlando. Now, that patient is recovering, and though it's pretty unlikely that he actually passed the MERS virus on to anyone else, health officials aren't taking any chances. And that includes making phone calls to a number of local people who were on that man's flight.
A man infected with the MERS virus likely didn't know he was sick when he passed through the international gates here at Logan. The passenger began his trip in Saudi Arabia, traveled to London, and on May 1st, his Delta flight had stops in Boston and Atlanta before heading to Orlando.
People who are just going through Logan on May 1st, there's nothing to worry about. People who we believe may have some risk, like people on the flights, they're being contacted.
So are airport and customs workers in terminals E and A. MERS is a new virus with 538 reported cases, mostly in the Middle East. 145 of those patients have died. The symptoms at first resemble a bad cold or the flu.
But people can go on to develop pneumonia and shortness of breath and even kidney problems. And as we know, in the Middle East, about 30% of people who develop it or contract it actually die. So it's a serious infection.
MERS is not airborne. Good news for airline passengers.
Any sort of casual contact that you might have on a plane or certainly walking by someone at Logan Airport is unlikely to make you sick.
News of MERS appearance at Logan Airport doesn't panic travelers, but they say they're not surprised sickness could spread through air travel.
What if the person sitting next to you was the person who had it?
If there's a chance of getting sick, it gets increased at the airport or on a flight.
Most of the people who have gotten MERS from someone else were actually taking care of that person and in very close contact. There's no indication that anyone on the plane has gotten sick. Now, this illness has about a 15-day incubation period at most, so people are in the clear around May 15th. Live in the Satellite Center, Lauren Leamanczyk, WBZ News. Lisa, back to you.
All right, Lauren, thank you.